Again, let's consider the case. The case is a very common case. You're doing your clinic rounds, you're in the hospital, and then you pass by this person. Family's there, the person's not able to express himself anymore because he's suffering from an advanced terminal illness. Everybody thinks that it probably lasts a few weeks or a few days. And the family is looking at you and they ask you, can you hasten death? Or it's taking so long, can you speed it up a little bit? Of course, they won't say that. They'll say something like, we're prolonging the suffering. You're sitting in the hospital. We know you're doing the hospital medical care stuff, but we think that this medical care stuff that you do, which seems to work before, is now hampering death. And can you just stop everything? Or even better, can you do something so that he'll die soon, so that we can hasten death? Pretty much that's the question, and then you're caught in a dilemma. This discussion will focus on other ways of looking at things. If you haven't seen the video on self-determination, dignity, and pain and suffering, I suggest you go there first, because as far as things stand right now, if you're in a university medical center or you're undergoing training in a Western or Westernized society or country, those other things, self-determination, autonomy, right to decide for oneself, preventing suffering, pain, preserving dignity are the big things. They seldom teach a lot of ethics in medical school, especially the bioethics of death and dying, but they're going to teach some probably in like maybe 1 to 2 lectures out of 6 to 7 years of training, which is really sad. But that's the way things are right now. Within your 2 to 4 weeks of rotation doing end-of-life care, or rotation that focuses on death and dying, not the rotation with a lot of people dying, but focusing on the other stuff. We know so much, maybe we can do something about it. Not those rotations, but the other ones, which seems to focus on death and dying. We probably got these 3, hopefully. Out of 7 years, that's pretty much all you get, and then you go into practice, and then suddenly you're exposed to a whole bunch of people you cannot cure, and a whole bunch of people who will die under your watch, doing things with as little guidance as you can possibly get out of your 7 years of training, or 7 years of training plus your residency training and everything else, which is a sad thing again to think of. So now we go to the other issues. Our controversial idea, which is, well, it's actually not a controversial idea. We made it controversial, which is again really sad to think about. It's the sanctity of life argument. Yeah, you've heard about it, especially if you're in a country which has really strong traditional religious moral values and religious and spiritual beliefs like ours. We are also somewhat westernized, especially in the metropolitan area, especially in our university medical centers. We aspire to be very similar to the Western universities. I don't know why, but if they're going non-religious, maybe so do we. If they're going atheist or agnostic, maybe so do we. And if that's what the professor should be, then maybe we should, which is saddening again. A lot of things in... Anyway, and of course the first question is, how does this pan out? It is not a philosophical discussion. It's like, again, this just to give you things to think about, so that once you're doctors in 1 to 2 years, you can sort of wade through the topic if you really want to go in there. And I suggest you do it, because these are people's lives and people's suffering you're dealing with. Don't just remember everything we told you, or don't just do everything your professors are doing or your consultants are doing. Think for yourself, especially to decide whether something is good or bad. Why is it such a difficult topic? A lot of care consultants probably won't even go there too much. We'll say another reason is sanctity of life, and because life is sacred and therefore you shouldn't do this, and this is justified in various ways depending on your religious tradition. And in the Judeo-Christian belief, man is made in the image of God, and we kind of stop there. That's what I do. A lot of people actually do a lot less than that. So what's the deal? Well, the big deal is the university right now, after the age of reason and enlightenment, decided that it's the place where you try to learn the real thing. And the real thing right now, as far as Western or Westernized institutions are concerned, is the objective view of the world. What you see, what you can prove, is the good thing. And the thing that's religious and spiritual, that belongs to the church, and that doesn't belong to the university, or that doesn't belong to academic scholarly work, especially in university medical centers. Medical school uses science and technology to heal people and prevent suffering and help prolong life. Even if the people in the other side, the people in the church, the spiritual people, the religious people, will tell you that there's a lot of other things involved when you talk about death and dying and suffering. Death, dying, and suffering, life after death, are huge, big, central themes in many of the world's major religions. But we don't want to go in there. There's a separation. How can that be when you're dealing with a person who is religious? Your patients are not as objective as you. They're not as scholarly or academically minded as you. So you cannot impose those things on your patient. You can act that way, but they are hoping that you won't. As far as my experience or our medical school batch experience is concerned, these little tiny subjects, these little tiny lectures are happening while we're trying to figure out big, difficult stuff to figure out and big, difficult stuff to remember. The first series of lectures on ethics and law, good, right, lawful, legal, was delivered during the time we are so worried that we might fail in biochemistry. We're trying to memorize all the formulas of the Krebs cycle, a pathway. If we don't, we'll probably fail. And that's taking up a lot of our time, a lot of our effort, and a lot of our worries. And because we want to be doctors. And the way medicine is being advertised right from the start, from first year medical school all the way till the end, it's scientific. The ethics and the philosophical excursions are nice, but you can be a doctor without them. So we look at these little tiny lectures given by Dr. Medina's counterpart during that time. I can't even remember who they are. So that's how bad things are. I probably slept through some of them. If you're so stressed and you have this little tiny lecture about ethics and you think it's not that important, you'll probably just take time to nap and recharge until the next lecture on pathophysiology, which is another tough lecture, or before your exam this afternoon. A lot of trainees would graduate with barely any ethics or ethical thought influencing their actions. The only ethical stuff that are retained, especially if you go through internship, the practical stuff, see one, do one period, is the kind of ethical practice, or is the kind of practice that you see the other doctors, the older doctors or their consultants are doing. So if they're doing it and it looks like it's acceptable practice, maybe it's ethical, and that's pretty much the end of the story. And of course, lay people don't know this. They'll be surprised if we tell them the way we doctors figure out what's good or what's bad, or the way we act ethically in very ethically charged situations is very simple. We're doing this because when we were students, when we were trainees, everyone else was doing this, and that's pretty much the end of the story. Some of us will have some little tiny 1 to 2 step justification just to calm down our conscience, but that's pretty much as far as we'll go, because there's so many information crammed inside our brain, and that's pretty much all we learned. Anything beyond that, we just came up with it ourselves. It didn't come from our training at all. And these little tiny justifications would be, we should do that because those poor people waiting for the bed are outside, and we're not doing anything for this one. That seems to make sense. Justice. Well, we used a big word. Maybe that's true, and that's pretty much as far as our ethical thought process will go. And of course, we don't really say that. That's not the kind of thing the medical community will tell everyone, but that's pretty much how we think most of the time. It might even be the case when, we try to formulate our code of ethics. All professional organizations know this. The one on paper is one thing. We tell everyone this is what we do. This is our ethical platform, how we behave ethically. And we hope that you assume that we're all behaving ethically. That's the big question mark. And so when you define us in terms of ethical behavior, in terms of how we behave, let's look at the document. Of course, the big question is how much of the document we follow. I'm not referring to any particular country. Okay, that's my disclaimer. I might get in trouble. So are all the doctors, or how many doctors are actually following the entire document? How many doctors actually read the document and actually absorbed everything inside? Because presumably everything that's written in that short document would try to cover almost everything, or a lot of the critical stuff in medical practice that's ethically charged, the ones that cause a lot of moral or ethical dilemma. And that's easy to figure out. You just do a survey, and then you might encounter the realization that so many doctors actually don't know the document too well. So many of the consultants who are teaching students how to act or behave, and of course the trainees assume, because they're the role models, that these big names are acting in a very ethical or moral way. If you're a student, you assume that. You're having a hard time trying to be like them, and the least they can do is act ethically so that you don't get in trouble if you copy the way they think. My suggestion is don't do that. Don't do that. Think for yourself. That's the purpose of universities, to help you think for yourself, to help you wade through life's experiences and absorb all the information that might help you, but ultimately for you to decide for yourself. Be your own person and be aware of the situation around you. Not just swallow everything we put in you. A computer can do that. You're not a computer. A parrot can also do that, but you're a person, an educated one, and that's what you should be getting out of the university. And especially if the facts we crammed into you, especially in clinical medicine, the practice of medicine will probably be outdated anywhere between 6 months to 2 years. Right? That's a short period of time. Everybody agrees it's getting outdated faster and faster and faster. And even this little talk, I seem to ramble, this rambling that hopefully makes a little bit of sense, will be helpful. I'm guessing this would be one of the last stuff you'll hear from consultants as far as an ethical perspective is concerned. Once you go into practice, that's pretty much the end of the story. It's very purely clinical, and the ethics that you'll probably hear are like really simple stuff, like you should listen to the patient, you should hold the hands, that's very good, that's very ethical and moral. And of course, I have no idea why it is such a great ethical thing to do. I mean, everyone should be doing that. Well, maybe it's great because nobody is doing that. And that's pretty bad. That's probably pointing to increasing lack of caring and compassion in medical practice. Of course, that's another topic, and we won't go there right now. So anyways, going back to sanctity of life. It's a big topic. Why? Because when we think about sanctity, we think about religion, think about religious belief. Sanctity, sacred, life is sacred. Why? If you're in a Western society, then Western societies are strongly influenced, at least their values and morals are. For several centuries, they've been strongly influenced by Judeo-Christian, Christian, or Catholic beliefs. And in a few centuries, compared to the time that we'd had it, the Western societies have decided they don't want it anymore. So in a span of a few centuries, compared to the huge expanse of time these beliefs have guided them, they decided that maybe it's not such a good thing. And they've been so successful that in 50 to 100 years, it's almost completely wiped out of the academic institutions. The ones who are training the future leaders and movers of society and influencers of society for the next several generations. Pretty much wiped out the traditional religious, spiritual values, traditional morals. The philosophy would say, we killed God. So we pretty much took that out. And in its place, well, we don't know. We don't know yet. The West has been trying to come up with all sorts of things to replace it with. So that's the reason why philosophy is an exciting thing to go into right now. Before it wasn't. It's such a dry thing, What's moral, what's right, what's ethical, what's not, and then you go to religion. You go to your firmly set moral and ethical values. And if it's the West, again, it's the Judeo-Christian, Christian, or Catholic traditions. And that pretty much is the end of the story. And that kept the society going in a relatively peaceful manner for a long time. And we decided it's not really peaceful. China does this. Maybe it's responsible for this also. There's inequality, and we try to pull it down, and maybe it's not the reason why it's helpful. Maybe we are the ones who are helping ourselves, so why bother with this ancient idea of God and heaven and things like that, right? So we took it out, and the reason why philosophy is exciting right now is because I think they're just trying to come up with something to replace the one they took out, and everybody's coming up with their own ideas. The more people it pleases, the more acceptable it becomes. That's the reason why the most popular ones right now is something along the lines of increasing one's happiness or well-being, or increasing increasing society's happiness and well-being, and that's pretty much the end of the story. Of course, how you define it is another matter. And everyone's saying, well, how come our society is turning out to be this way? Well, my answer is, well, you asked for it. Now you're getting it in a short span of time. Well, anyway, so sanctity of life. And it's hard to go against this argument, because if you go to your traditional beliefs, the argument is religious. It's based on your beliefs. If you go Christian, Catholic beliefs, well, you're made in the image of God, and God himself is saying this, and then it's clear in the scripture what's good or what's bad. I mean, you even have a scripture of caring and nurturing and helping the sick and helping people out. I mean, it's not a teaching of killing. Even the biggest person, or the biggest personality in that religious tradition, offered his person to be killed, right? To sacrifice. And of course, if you think of a philosophy of pleasure and happiness and well-being for everyone, why would you want an approach or an ethical philosophy or an ethical approach that says that you should sacrifice up to the point that you can get yourself killed? That's not going to be very popular. Of course, in medical school, we're ripe for such an attitude. The reason why we can cure the person is because we can study this person. And we can try to figure out the chemicals and the physical mechanisms and the physiology and the pathophysiology of disease, sickness, and everything else. Even the way he thinks, we can probably figure it out by looking at his brain and his neurons, and we'll come up with all sorts of technologies to figure that one out. And the reason why we are having so much success is because we are looking at this person as a material being. We took out the subjective part, and together with the subjective part is the spiritual part. I mean, it goes with the subjective part as far as we're concerned. It's nice, but that's not science, and we don't want anything to do with it. So that's what happened. So I can give further arguments for the sanctity of life, but I'm telling you what the deal is as far as this argument is concerned. If you're going to go and speak about hastening death, and then you stand up there and you say, we shouldn't be doing it, my stand is life is sacred, and that's pretty much your main argument, and you'll use that argument to argue against all sorts of other things like preventing suffering and dignity, and you kind of limit the power of those arguments, and you won't be very, very successful. People in the audience will look at you and ask, is this person a priest? Well, he's not. How come he's talking like that? I mean, is this person inside the university? Are we giving him a salary? I mean, it doesn't look like he should be here. Maybe he should go back to his church, right? So it's taken completely out of the argument. Now, this is also very strange for another reason. When you're about to die, now, if you were brought up, and most of us are, in a society which still carries some sense of Judeo-Christian, Christian or Catholic beliefs, and, their parents teach you what's right and what's wrong, even in a very westernized, less religious society, they teach you what's right, what's wrong, what's good, or what's bad. If you go back several centuries, you will know that those things were derived from Judeo-Christian, Christian, or Catholic beliefs. You were brought up with those kinds of ethics and values. The thing that helps out your conscience, the way you think about good or bad, are those things inside you. And along with those things, they might have been taught about a higher being. In this society, our society, 80 to 90% probably got that. I mean, the religions vary, but, we're made to think of a higher being, and the teaching, especially in our country, is benevolent. This higher being is very benevolent. Even the punishment has a sense of justice, love, and caring attached to it. Go back and be at peace with God, or be one with God. That's pretty much the teaching. And so now we have this person, your patient, not the doctor. We're not talking about the doctor. We're talking about the patient who's about to die. And he's about to die, he's lying down in bed. He's still conscious, or he goes in and out of consciousness, and he knows he's about to die in a few days. If you're in that situation, and I know it's very hard to imagine, some of you won't even be able to imagine it because it's such a hard thing to swallow, right? So imagine you're that person. What are you most anxious about? We actually did studies, but we cannot go that close to death. So most of the studies were done like several days before or several weeks before. But the pattern is so clear. Even without the studies, you can figure it out. The closer you are to death, the more anxious you are, or the more troubled you are about what happens when you die. And the less concerned you are about having less pain, not being nauseated, the less concerned you are about the control of physical symptoms. Actually, near death, I can imagine people will be happy if they're actually still feeling something, even if it's nausea, because that's proof that they're still not dead, especially if they're so worried about death. That's fear of death. And how do you cure or how do you address fear of death if you're going to use the purely objective, very materialistic Western medical approach, materialistic view of a person that we have? You cannot. What do you do with that, right? So, how do you address that? If we take the purely materialistic or objective view of a human being, well, your organs are fading, your brain is beginning to stop working, so your consciousness is about to disappear. You die, and then your organs turn into jello, and then you disintegrate, and that's pretty much the end of this story. There's no afterlife. And I'm guessing those people who profess to being agnostics or atheists, when faced with death so close, they begin to question their beliefs, especially if they were raised in a very theistic, God or religion influenced environment. Because usually the atheism or the agnosticism or this very material, non-religious, non-spiritual, non-Christian, non-Catholic view of the world was learned later on in the environment of the educational institution, especially the university institution, where scholarly work or rational work has to be scientific. So these are superficial justifications and rationalizations they've been using during most of their lives. But that's on the surface. Now, the fact that he really knows he's so near death, those things on the surface tend to get questioned so much, and the things underneath, which are more firmly rooted, spring out. Then therefore you fear death. Because if you really think about it, if you're so convinced from the very roots of your being all the way up, it's not just surface rationalization and justifications for all the bad things or for all the things you've been doing or behaving during the majority of your adult life or majority of your life before you became terminal, then you shouldn't be too worried or anxious about death. You would probably just say, well, that's how life is. Just put me to sleep and I'll disappear from the world, and that's the end of the story. Of course, some people will argue there's something in human beings also. It's inherent to fear complete annihilation. We want to exist. Unless you're depressed and you want to kill yourself, you want to commit suicide, but I'm not talking about those. You're meant to exist, and if you're about to die, then that's the opposite of being. That's non-being. So that's the sanctity of life.